villages in 2 districts of central Kerala are energetically responding to a message. The message of lifestyle modification. Scores of volunteers, doctors and paramedical personnel are actively involved in a project called No Diabetes, which targets the students and the community to inform them about the ills of faulty lifestyle, inducing them to take steps for preventing lifestyle diseases, particularly diabetes. The state of Kerala is unique in many respects. In a developing country, which is home to a third of the world's poor, Kerala presents a contrasting picture. In many of the parameters that are used to assess the quality of life, Kerala is much ahead of the country and nearer to Western countries. The major factors contributing to such a unique situation are a wide network of health infrastructure and manpower, policies of successive state governments, and other social factors like women's education, general health awareness, and clean health habits of the people. The public health system in Kerala, with its 3-tier structure ranging from primary health centers to referral hospitals and medical colleges, have been able to make giant leaps in the health sector. Communicable diseases like malaria, tuberculosis and smallpox, which used to take a heavy toll on the population, have been eradicated or controlled. But the betterment of living standards have brought with it a host of new illnesses too. Diabetes, heart disease, hypertension and stress-related diseases are on the increase, as statistics show.
Diabetes and other lifestyle diseases are expected to be more prevalent than other states in Kerala. To understand the ground realities, we conducted a study in 2007 in a rural community in central Kerala on the prevalence of diabetes and other lifestyle diseases, which revealed very startling results. Diabetes was present in more than 14.6% of adults, that is above the age of 18 years. And another 5.1% were having pre-diabetes. So 1 in 5 of the adult population is either diabetic or pre-diabetic. 1/3 of this adult population had hypertension and 1/3 had a cholesterol value above 200 milligrams per deciliter. Another important finding was the prevalence of central obesity, which was present in more than 70% of the adult population. All these point to the fact that diabetes and other lifestyle diseases are becoming a major health problem in this in the area which we analyzed.
The increased prevalence of diabetes and other lifestyle diseases can be traced to the changes in the lifestyle of the people of Kerala in recent decades. With the advent of material prosperity, there have been changes in the food habits, work pattern, and stress levels of the people. The main elements that are at fault in the lifestyle of the people of Kerala are overeating, which includes eating more than enough, and eating high-calorie food, including fried food items. Eating of more junk food, including the use of refined food with less fiber content, the use of canned food, and the fad of eating out, which increases consumption of junk food. Due to increased access to motor vehicles reducing walking, increase in sedentary jobs due to a predominantly service sector economy, a reduced need for physical labor with the use of mechanized gadgets even for household chores, increased stress due to social competition, stress at workplace, and pressure to manage an affluent lifestyle, increase in consumption of alcohol, smoking, and substance abuse. All these factors lead to high risk of developing lifestyle diseases like diabetes. The only way to reduce this risk is to avoid these factors and cultivate a healthy lifestyle. For patients already having such diseases too, management of lifestyle is very important in keeping the diseases under control. Effective management of lifestyle requires awareness about the ill effects of a faulty lifestyle and awareness about what constitutes a healthy lifestyle.
Our experience during the last 25 years regarding the state of awareness among the masses about the non-communicable diseases reveals the fact that the knowledge among the general public regarding this disease is very low. We have to educate the so-called educated people, the so-called the upper class and the upper middle class, the rich and the upper middle class people regarding the importance of preventing these diseases. Because many of the educated people, so-called educated people, that is professionals as well as postgraduates, have very little, very meager knowledge about the factors related to non-communicable diseases, diabetes, etc. This has been revealed in several of the interviews which we conduct regularly with the patients when they come to the hospital diabetes clinic.
Even patients who have been diabetic for years are not well informed about many aspects of diabetes management.
കൊളസ്ട്രോളിന്റെ അറിയാവോ? ഇല്ല. പിന്നെ പ്രമേഹത്തെ പറ്റി എന്തൊക്കെ അറിയാം? എനിക്ക് ഒന്നും അറിയത്തില്ല. പിന്നെ ആദ്യമായിട്ടാണ് അമ്മ ഇങ്ങനൊരു കാണുന്നത്. നിയന്ത്രിച്ചിട്ടൊന്നും ശരിയാവുന്നില്ല. 5 വർഷത്തോളം നല്ല സ്ട്രിക്റ്റ് കൺട്രോളിലാണ്. കൺട്രോളായിരുന്നു. അപ്പോൾ മധുരം ഇടാതെ ചായ കഴിക്കുകയും പിന്നെ ചോറ് അല്പം കുറയ്ക്കുകയും ഒക്കെ. പിന്നെ ശാപ്പാടിൻ്റെ കാര്യത്തിൽ വിട്ടുവീഴ്ച ഒന്നുമില്ല. അങ്ങ് തിന്നും, വൈകിട്ട് തിന്നും, ഉച്ചയ്ക്ക് തിന്നും, രാവിലെ കഴിക്കും. ഇപ്പോഴും രാത്രി പിന്നെ അതായത് പൊതുവെ ഡയബറ്റിക് പേഷ്യൻ്റ് ആണെന്ന് എന്നെ കണ്ടാൽ തോന്നത്തില്ലെന്ന് ഓരോരുത്തർ പറയുന്നു. പിന്നെ ഉഴുന്നോടെ കഴിക്കാമല്ലോ, ഉണ്ടാക്കി എണ്ണ പുറത്ത്. കടയിലൊക്കെ ചെന്നാൽ അതേ കിട്ടത്തുള്ളൂ. പിന്നെ അമ്മയ്ക്ക് ഷുഗറിന്റെ നോർമൽ വാല്യൂ അങ്ങനെയുള്ളതൊക്കെ അറിയാമായിരുന്നോ?
ഇല്ല, അത് ഇവിടെ വന്നിട്ടില്ല.
ഇവിടെ വന്നതിന് ശേഷം ഇപ്പോൾ അറിയാമോ അതിനെ പറ്റിയൊക്കെ?
നോർമൽ വാല്യൂ അറിയാം, 110.
ഏതാ റേഞ്ച്?
അങ്ങനെ അറിയില്ല, കൂടുതൽ ഡീറ്റെയിൽ.
ഡയറ്റ് ഒക്കെ ഒത്തിരി സ്ട്രിക്ട്ലി കൺട്രോൾഡ് ആണോ?
ആയിരുന്നില്ല, ഇപ്പോൾ പതുക്കെ തുടങ്ങണമെന്നുണ്ട്. കിട്ടുന്നതെല്ലാം കഴിക്കുന്ന ഒരു സ്വഭാവമാണ് ഞാൻ. ഫ്രൈഡ് സാധനമൊക്കെ എൻ്റെ ഒരു ധാരണ, അത് മധുരമില്ലല്ലോ, അപ്പോൾ അത് കഴിക്കാം എന്നുള്ളൊരു തിങ്കിങ്ങിലാണ് ആയിരുന്നു. ഇപ്പോൾ ഡയറ്റീഷ്യനെ കണ്ടപ്പോൾ ആ ഒരു ഇതൊക്കെ വായിച്ചു നോക്കിയപ്പോൾ നമ്മൾ ഡയറ്റാണ് മെയിൻ പ്രശ്നം എന്ന് മനസ്സിലായി. ഐ യൂസ്ഡ് ടു ടേക്ക് എ ലോട്ട് ഓഫ് സ്വീറ്റ്സ്.
ഇത് പറയുന്നല്ലാതെ അത് എവിടെ വന്ന് സയൻസ് പരമായൊന്നും ഞാൻ പഠിച്ചിട്ടില്ല. പറയും കിഡ്നിക്ക് കേടാ. ഞാൻ ഈ ടാബ്ലറ്റ് അടൂന്നൊക്കെ കഴിക്കും, പക്ഷെ അങ്ങനെ ഇപ്പോൾ കണ്ടിന്യൂ ആയിട്ട് എവിടെയെങ്കിലും സ്ഥായിയായ ഒരു ചികിത്സ ഇതുവരെ വന്നിട്ടില്ല.
പ്രമേഹത്തെ പറ്റി നല്ലൊരു അറിവുണ്ടോ? എനിക്കറിയാവോ പ്രമേഹം
അവിടെ ഹസ്ബൻഡിനുണ്ട്.
അതുകൊണ്ട് കഴിയുന്നത്ര ശ്രദ്ധിച്ചാണോ പോകുന്നതൊക്കെ?
കുറേയൊക്കെ ശ്രദ്ധിക്കും. നടക്കാൻ പോയല്ല, മുട്ടിന്.
Incomplete, superficial and inaccurate information gathered from a variety of sources like hearsay, health magazines and television programs will do more harm than good for the people.
നമ്മളുടെ ബ്ലഡ് ഷുഗർ ലെവലിലൂടെയാണ് ബ്ലഡ് ടെസ്റ്റ് ചെയ്താൽ മാത്രമേ പ്രമേഹം ഉണ്ടോ ഇല്ലയോ എന്ന് നിർണ്ണയിക്കാനായിട്ട് സാധിക്കുകയുള്ളൂ. അല്ലെങ്കിൽ ഒരു വ്യക്തിയെ കണ്ടുകൊണ്ട് നമുക്ക് പ്രമേഹം ഉണ്ടെന്ന് പറയാനായിട്ട് സാധിക്കില്ല.
In patients, poor management will result in reduced health and an increased likelihood of developing complications.
The people have to be educated about good and bad food, the amount of food they have to take, the bad effects of the junk food. They have to be educated regarding the importance of exercise, regular exercise. They have to be educated regarding the importance of stress management in the prevention and management of diabetes. The doctor should act as a teacher, telling about all the complications which can happen if his diabetes is not well controlled.
In Kerala, which places a high value on education, people are always receptive to new knowledge. Historically, they have been able to respond to the changes in the world by acquiring information and changing their ways of life according to this information. In such a community, it is comparatively easier to induce positive behavioral changes. But the change that has occurred in the morbidity profile of the state has largely escaped the notice of the government. The sad fact is that both the public and private sector health systems are not focused on educating people to prevent lifestyle diseases. In a state with about 35 million people, in whom around 4 million are affected by diabetes, there are less than 10 diabetes clinics where proper preventive education is offered. The formal education system of Kerala is large, with over 5.5 million students enrolled in schools. The school syllabi also lack useful practical information about the prevention and control of diabetes and other lifestyle diseases. An informal intervention to spread the message of healthy lifestyle becomes a pressing need in this context. The educational campaign has two fronts to it. The most common thing to do is to educate the patients who come to the hospital. Patient education is carried out by the nurses and diet counselors through specially conducted classes targeting the patients. Awareness camps for community are also organized from time to time under the auspices of the hospital. But considering the unique and alarming situation in a place like Kerala, hospital-based educational programs are not enough. It is necessary to reach out to the wider public with information and practical tips if we are to induce a declining trend in the lifestyle disease pattern in the near future. So, a strategy to approach the community through students who are enrolled in the schools and who represent a cross-section of the community was developed. This strategy is being implemented by the No Diabetes project, currently being carried out in 2 districts of Kerala. The No Diabetes project envisages a two-pronged approach. On the one hand, it is oriented towards the future. The students of today will grow up to become the next generation. At a young age, they are receptive to information and can make changes in their lifestyle before it crystallizes into a faulty one. This will enable us to reduce incidence of these diseases in the next generation. Secondly, students will be able to make an impact in the present itself. They can be motivated to pass on the information they receive to their family members and to the community at large. The project is aimed at educating a community of about 4 million people in the 2 districts of its operation. Classes in 865 schools, 300,000 students, 200,000 parents, and 5,000 teachers to participate. 2 sessions for high school students, awareness classes and yoga training sessions. Anthropometric, biochemical and demographic data collection for analysis. Weekend medical camps and awareness classes for parents and community. Rapid industrialization and urbanization being witnessed in various parts of the developing world will lead to scenarios similar to that of Kerala. Changes in lifestyle that occur in the span of a single generation can trigger patterns of lifestyle-related diseases, and the health and educational sectors will be caught unawares, unable to cope with this alarming situation. The problem in Kerala has already crossed the threshold of being an epidemic, with 1 in 5 adults affected by diabetes.
So my dear children, people of my age, we have not behaved ourselves, but you have the capability of preventing becoming diabetic.
In the last 2 years, No Diabetes project, with the support of local administration and other agencies, has created waves of awareness about lifestyle modification in the targeted communities, underlining the importance of informal intervention in health education. The journey of these young volunteers goes on. Their words are their weapons in their determined fight against ignorance in minds that breeds diseases in the body. Every day, they sow the seeds of knowledge in yet another group of students, hoping that these seeds will sprout and spread and will bloom into a spring of health and joy.